Hello, welcome to Volunteer Orientation. Whether this is your first Medworks Clinic or you've volunteered with Medworks for years, this short orientation video is relevant for you. Cleveland is home to world-class healthcare, and Cleveland is also the second poorest large city in the United States. People living in poverty struggle to afford healthcare. Their health needs go unmet, and then their conditions worsen. Medworks' vision is that people in our community receive the healthcare they need to lead healthy lives. At the core of who we are, Medworks is a portal, an accessible entry point into long-term care. A collaborative portal, meaning in collaboration with healthcare partners, healthcare professionals, and social service agencies, we invite people onto a path to health through our 100% free health clinics. At a Medworks Clinic, we not only provide a day of quality health care for every patient, we also want to connect patients to permanent medical homes, either at the location where we are holding the clinic or by recommending a healthcare facility closer to their home. The goal of Medworks Care Plus Connect model is to place patients on a path to health. We do that by providing care, which is healthcare professionals volunteering their time to provide quality care and education, helping patients understand their health conditions and how to care for their health needs. For Connect, Medworks insurance navigators connect patients with health insurance, and we also connect patients with follow-up appointments and other social services needed, such as food assistance. These three things work together to place patients on a path to health. Now let's do a quick walkthrough of a Medworks clinic to understand how we meet our goal. At patient registration, patients may be unsure. They may be unsure of who we are, what questions they might have to answer, what services they need, and what this experience will entail. Our goal at registration is to help ease their concerns and help them to feel comfortable. Explain what services we offer and ask them what services they are interested in receiving. They may get more than one service. Ask if they have questions that we can answer. And if they struggle to speak English, ask for a bilingual person nearby to help, if available. The next step in the process is medical triage. The purpose of medical triage, just like a doctor's office, is to have nurses meet with each patient to take blood pressure, heart rate, understand their current medications, and any existing medical conditions. If any issues arise, such as really high blood pressure or concerns regarding medications, ask for a doctor who should be available nearby to determine next steps. After medical triage, a patient guide will take the patient to the waiting area until a doctor is ready to see them. In the waiting area, patients are free to interact with other community partners until they are called. The next step in the process is a patient receiving their medical, dental, and/or vision services. As a medical, dental, or vision professional, we ask that you provide not only high quality care, but that you also educate patients, really help them understand their conditions and how to take care of their health. If the Medworks Clinic is being held at a medical facility, we will provide you with a list of the ongoing services provided at that facility. Familiarize yourself with the list so that you can recommend these ongoing services if needed. If a patient needs follow-up care, recommend that they schedule an appointment before they leave. If the needed services aren't available at that facility, suggest that the patient meet with a Medworks navigation team member at checkout to be connected to other resources. For mental health concerns, we will have social workers available to assess the patient's needs and recommend next steps. Ask a patient guide to navigate your patient to a social worker. Patient guides will be available all throughout the clinic to guide patients to their next step in the process. We will let you know if there is a lab or pharmacy available, either at the site or nearby. We will also let you know which tests are available. If you place an order for a lab, please place your name on the requisition. Patient guides will walk the patient and their results back to you for next steps. Medworks will fund 30-day prescriptions. You can write requisitions for these prescriptions with the exception of mental health medications. In that case, we want the patient in the care of a mental health professional. Checkout is very important to our overall mission. All patients should go through checkout. This is where they hand in important paperwork and we give them a copy of their chart. They should also talk with insurance navigators to answer any questions or enroll in insurance. They should also be guided to schedulers for follow-up appointments if needed. Make sure patients are getting a complete checkout experience. Volunteers in the checkout area should proactively talk with patients about their needs at checkout and guide patients to all the appropriate resources. We are coming from different healthcare systems and communities. At a Medworks Clinic, we work together to help each neighbor who comes to see us feel cared for, get their needs met, and leave with next steps in place. Together, we are placing patients on a path to health. If you have any questions at the Medworks Clinic, ask a staff member or the lead in your area. And thank you so much for joining us and volunteering your time to make all of this possible.